And today's first story is about a business I truly wish I had known about earlier that focuses on pediatric home health care. As a parent of two kids who have varying forms of illnesses, I would have loved to have known there were resources in my own backyard. Owner Kirk Petrie tells us more about Tender Hearts.
We're a pediatric medical equipment company. We specialize from everything from respiratory products, rehab products, to general everyday items like diapers and things like that. But we're only for the pediatric population.
And that's important for around here because there's not other services like this, right?
No, ma'am. We're the only specialized pediatric provider in the area.
And so I imagine you get a lot of calls from parents, concerned about things and dealing with issues.
Yes, ma'am. We get a lot of... we have a lot of parents that have babies, ventilators, just spinal bifida, cerebral palsy, easy things like that. But, we're a resource that they can go to, that they can call. Even if they don't need supplies, they can just ask what our previous experiences were. Or we have a lot of parents that are willing to be a resource for other parents so that we can send, them to talk to as well, kind of like a support group.
And tell us a little bit about the history of Tender Hearts and why this is close to your heart as well.
My son was in the neonatal intensive care unit. He was born in 1997, and I was working at the hospital as an orderly. Didn't understand what was going on. He was on a ventilator. He had a lot of things going on. And so I chose to go to college to do neonatal respiratory therapy so that I could understand more of what was going on, and I devoted the rest of my life to helping babies like my son. He's 15 now. He's doing awesome, going to Europe, got no long-lasting problems. But so that's kind of what drove me to this path, and worked in Neo until 2004 when we opened up this.
I know with my daughter, she's 15 now, but she had leukemia when she was 3, and there were a lot of questions in the middle of the night. Children like that, if they get any type of fever, you're rushing to the hospital. It's wonderful to know that someone around here local knows what you're talking about. And, if you call and you have questions about equipment, and I imagine you do some of this stuff in the middle of the night.
We do a lot in the middle of the night. We're on call 24/7, and it's usually me on call to take the clinical questions and things like that. And parents are willing, they're okay to call 3 o'clock in the morning if they have a question, because there's nothing more stressful than being at home with a sick child and not having anybody to turn to. So we don't mind it. We encourage it, because the more comfortable the parents are at home, the more success we're going to get with the children's well-being.
What kind of feedback have you gotten back from parents?
Recently we just helped a little 4-month-old get admitted to the hospital. The doctors that they were seeing just were not seeing the issues that I was seeing and that the mom was seeing. So the mom brought the baby in here 3 times for me to look at, and I called over to Virginia Baptist. Lynchburg General Hospital, since that's where pediatrics is now, and talked to the peds hospitalist over there, and I got them to do me a favor and see the baby, and got the baby admitted over to pediatrics, which is where the baby needed to be to begin with. The parents like being able to call and ask questions, even if it's a question that I don't know. I have a lot of friends in the field that I can field the questions to, so I don't mind getting back to parents. So they just appreciate having somebody there that they can talk to.
And you have a bunch of different types of equipment here. We're not just talking about serious situations, but kids with crutches and cute little foam critter things over here.
Yeah, the little foam critters are nice. Just padding under the arms, something easy that we wouldn't think about, and incorporating it into something cute like a stuffed animal. It makes a little 4-year-old that broke his leg maybe not so upset that he broke his leg when we can incorporate fun things into it. We do the same thing with our hand braces and our other braces and things like that. Pretty colors and stuff, and nebulizers. We do them in different shapes, and animals and stuff like that, little dragons that spew out smoke instead of medicine. So just whatever's going to make the child more at ease, that's kind of what our goal is.
And one thing you were telling me a little earlier that I thought was wonderful is that you help bill insurance, because when it comes down to money is always an issue.
Yeah. Most all of our items are insurance covered, and we do the majority with Medicaid and all the HMOs of Medicaid. We do also bill private insurances as well, but we really, really work with the insurance companies to get everything pre-authorized so that our parents don't have out-of-pocket expenses, because they have enough to pay for as it is.
And Tender Hearts is just a wonderful resource. They're located on Wigington Road in Lynchburg, 434-385-4001, tenderheartshomehealth.com.